Let's discuss the treatment of Achilles tendon ruptures that can be treated non-operatively, which will include functional bracing, versus surgically. This can be done either with an open incision over the Achilles tendon or percutaneously, which means we use smaller incisions to avoid a large cut. What's the main risk of surgical versus non-surgical treatment of Achilles tendon? With surgical treatment, the main risk is wound healing. We see this most prevalent in patients who use tobacco. We know that nicotine decreases the blood supply to the incision. In addition, steroid users, diabetics with poor glycemic or blood sugar control, and obese patients have a higher risk of poor wound healing. In those that we use functional bracing for, where surgery might not be the best option in a otherwise unhealthy patient, functional bracing patients, although they don't have an incision over their Achilles tendon, they are at a higher risk for re-rupture. We see that this can occur in around 40%, up to 40% of patients.
Achilles tendon disorders are prevalent among athletes who engage in sports involving sudden explosive accelerations, jumping, or maximal effort, and can vary from tendinopathies to ruptures. Males are more likely to experience Achilles tendon dysfunction. The Achilles tendon acts across three joints. When it contracts, it works to flex the knee, plantar flex the ankle, and supinate the subtalar joint. The Achilles tendon functions as the primary contributor to plantar flexion during gait, contributing to about 93% of the movement. It's also estimated that the Achilles tendon goes under a tension of 250% of body weight. At the same time, the running load applies from 6 to 8 times the body weight. The Achilles tendon also has viscoelastic properties that allows it to absorb energy and to contribute to explosive movements and decrease ground contact times. It's important to know that tendons will adapt and respond to repetitive forces, which will eventually alter the tissue composition and biomechanical capacity. You might be wondering what you can do to decrease the risk of Achilles tendinopathy. My general advice would be to address the modifiable intrinsic risk factors like your body composition, biomechanics, strength, and monitor acute and chronic workload ratios. Go after the low-hanging fruit first, and also engage in a comprehensive strength and conditioning program that includes working on both the contractile and non-contractile components of your gastrosoleus complex to help withstand the demands of your sport or activity. Here are a couple of exercises, general exercises that you can incorporate into your workout routine to help mitigate your risk.